Hey, it's Jessica DeMassa with WTF Health. What's the future of health? I am talking to the who's who of health tech and healthcare innovation in person now. So we get to dive in to the big news coming out of Transcarent, hearing from the chairman and CEO of that company about Walmart. But I want new information on Walmart. I heard Walmart speak here at Health. And so I heard Cheryl Pigas, who I guess you've worked with. She shouted out your deal from the main stage. Very exciting. So I want to, I'd like to kind of pick up where our conversation left off when you guys broke the news. So you guys are helping bring Walmart's everyday low prices on their health services, their prescription drugs, into the self-insured employer market, so making it available to other self-insured employers to buy. Cheryl's talking on stage about Walmart's approach to care, saying things that you'd never hear from like a health plan or a health system. We want to focus on the quality of life for the consumer. We're looking at telehealth as part of an omni-channel distribution of healthcare. Like, awesome. We're focused on three things: social determinants of health, personal behavior, and then clinical care. Talk to me about what you're doing at Transcarent and how this is in alignment with what she's talking about, because this is a big paradigm shift in the way that she's even describing what the healthcare experience is like at Walmart. How does this fit into what you've been telling me about the disruption of the payer and how Transcarent is working to really reshape the healthcare experience around the dollar? That is a long question.
That is a super long question, and you've covered most of what I was going to say. But first and foremost, I think what Walmart's focus is on the consumer, front and center, because they're a consumer-oriented company. So when I've talked about consumerism in healthcare, and the idea of Transcarent is creating a new and different health and care experience that puts people back in charge, you could almost use those words for Walmart in terms of what they're doing. Because one, she is the executive vice president of health and care. And so again, it's not an accident that how do we keep people healthy? And she talks about healthy food, social determinants, and then how do we care for them? And I think her idea is you can do all of that at Walmart. What we're saying is we're going to extend a lot of those benefits to people who work for large self-insured organizations. And we're just going to make it easier for them to access benefits without having to go to Walmart. But a lot of those people may already go to Walmart. If they do, they can pick up their meds, they can schedule, they can make it more convenient using the Transcarent app to get access to their products and services.
All right, talk to me about, like, from a macro level, this shift that is happening. Because, I mean, I've heard you talk about the healthcare consumer since the Livongo days, before you even went public. I mean, in those interviews. I mean, we can go back and you're telling me about the consumer experience and how it really needs to shift. And at that time, it seemed like it was an uphill climb. Do you still feel like it's an uphill climb? Or it's like with organizations like Walmart or others like Amazon or, some of these other companies that we're used to in terms of meeting our needs and expectations as consumers, getting into healthcare in a real way this time around? Do you feel like that's it? We're on like a downhill trajectory now in the sense of like things are going to get easier?
No, this is the beginning of the hill.
Oh, God.
and I'm sorry to say that. I wish it was different. The good news is at Livongo, we demonstrated it could be done. And by doing that, we actually, we fueled the digital health industry. But now we've got to make sure that as we fuel that, we explain that it's not just about digital health, it's about an experience. An experience includes digital and bricks and mortar, what some people call clicks and mortar. And so that's number one. But this is the beginning, and we showed at Livongo you could create a better experience, you could improve care, and you could reduce the cost. And I think that's the goal of what Walmart wants to do. It's really exciting that Walmart and that Amazon, these big consumer companies, are focused on healthcare. And they're going to help us push it forward in terms of being able to say, we're going to consumerize healthcare. But look, there still is the big middle. And the big middle is all about friction. It's about billing. It's about narrow networks, co-pays, co-insurance, denying care, waiting rooms. Every one of those terms is anti-consumer. And our experience is about how do we not just go through that better, that would be navigating. How do we go completely around it and redesign this experience? And that's what we're doing. And so it's going to be a tough battle because these big organizations don't want to change. And even when they try to get better, sometimes they're incapable of getting better. So nobody wants to get a bill. We don't send bill. We eliminate co-pays. Those are the major changes that people really want in your experience and my experience.
So, I mean, as far as the these big retailers moving into this space, what are they bringing that you think is unique this time around? I mean, you've been in the health tech space for a long time. You've seen, and we've all seen, like them kind of come, try, go. Why is this time going to be different? And what are they bringing now that they've never brought before? I mean, in terms of leverage, where they've really got an opportunity to change the way that we experience healthcare.
Well, first and foremost, they are truly focused on the consumer experience every day. So that's something that payers are not focused on. The end user, we're the consumer, but we're one step removed from the people who are paying for our health care in most cases. So if we were paying for it, it would be fixed immediately, but we aren't. So we get some of our care what looks like for free because we don't pay directly for it. We get poor service, but we can't just stop and go somewhere else. All of that is not structured to give good consumer feedback and good consumer experience. These are organizations, they can start from scratch. So they don't need to make an enormous markup on a drug. In fact, they might sell a medication at no markup to get you in the store. So they have enormous leverage. They also have much longer time frames of investment. So most of our payers are running quarter to quarter. They are slaves to their earnings. And instead of reinvesting in the experience and taking care of people. And I think what you can see is during the pandemic, most of the healthcare organizations, the payers, increased profits dramatically. Yeah. Instead of reinvesting in people and saying, of all times now, we're going to double down in investment. But they went the opposite way. They took record profits. And, that's, I think, is a big difference. So we're going to see a consumer focus. It's going to happen, but it's not going to be easy. So we've got work to do.
Well, you are focused on, you guys at Transcarent, you're focused on the self-insured employer, which is probably like the most consumer type of player in this equation right now, because they are paying for it.
That's right.
They are footing the bill.
Right.
So what are you hearing from them? Because I've been tracking this whole rhetoric about the rise of the self-insured employer for I would say a little bit over a year now. More so even actually before COVID. So are we there with the self-insured employer? I often hear they don't know how much power and leverage they have when they see partnerships.
All that's true.
Okay.
All that's true. So one, some of them have woken up in a big way and they're taking charge. Two, they don't want to be the payer. So they've also complained, we're now up to, the Wall Street Journal reported, on average 16 different contracts that a large self-insured employer does just to try to get their people good care. And what are their people saying? More confusing, more complex, more costly, not getting better. So they know it's broken. So that's good. And the second thing is they are starting to realize now that they're going to have to take more charge of it. The idea of Transcarent is to say we can make it easier for you to take control and improve that experience without having to do another 16 contracts. So we're like a payer who works on behalf of self-insured employers as opposed to who works against them. And right now, the problem with payers is the more a self-insured employer spends, or the more all of us spend, the more money they make. So they will never be aligned. And the two important words in healthcare, alignment and experience. That's what we're focused on. But you have to get alignment, because if my job, if the only way I get a bonus in my job is by you spending more money, I'm going to work to have you spend more money. If I get rewarded for having you have a higher quality experience and lower spend, then that's what will happen. So the system in our healthcare today is working exactly as it's designed for payers. And we want to redesign that for all of us. And that's the goal of Transcarent.
Okay, one of the things I want to ask you here, and this is a frequently asked question that I get about Transcarent, they're like, Jessica, do you understand how Transcarent works with health plans? And I'm kind of like, kind of? So how do you guys, in the alignment with the self-insured employer, I get it, 100%. Can you talk through the alignment with the payer that the self-insured employer has to work with?
Well, we aren't really, again, we sit on top of the payer.
Okay.
So it would be just like if something, you had to have surgery. And what would you do? Generally, you'd Google it, one, to learn more about it. And then two, you might call a doctor that you know, or somebody very wise, like Matthew.
I would never call him.
I wouldn't call Matthew either. But you would call somebody and you'd ask them, you'd say, give me all the information you know. Give me your guidance. What would you do in this case? And then if they recommended a place, can you get me in there? So that's what they would do. But you wouldn't call your payer in most cases, and no one would, because the payer is going to give you, here's a limited number of options, and here's the lowest cost options, the best thing for us, not for you, but for us. So we sit on top of that. We're that person who you can call. But the difference is, unlike Matthew, we actually have experts who can tell you exactly what to do. Because if you're dealing with knee surgery, they may have worked on 20 knee surgeries that week. They know the best places, they know the best docs, they know the issues that you're going to run into before and after, so you can prepare. They might say, remember, you need to get crutches and have them in the car. Something simple like that. If you've been through it 20 times, you know. But if you haven't, it's your first time, you're like, oh, I wish I remembered to bring those crutches. And just simple stuff like that, or get your meds 2 days in advance so you don't walk out and have to get your meds. All those little tips make for a better, higher quality experience. We have experts who do that. We also want to make sure the surgery needs to get done. So we'll do a second opinion, because we know about 30% of surgeries don't need to get done. And so in those cases, what we serve is, we're just the friend that sits above the payer plan. So the good news is you can keep everything you're doing with the payer, but we offer more options, more choices, and higher quality.
It's better. This is how to get the most out of your plan.
That's right.
Awesome.
Yeah.
Okay.
Yeah. There we go.
Hey, I'll bottom line you there on that. How about that? If you're hiring, I mean.
Your words. I like that. John, see if you can do something.
See about that. The PR guy's like, I took note of that. All right, so last thing for you. I want to hear about Transcarent. I want to hear about what's next for you as you're looking to remake this health and care experience and figure out how to remove that middle. What's next for you guys? I mean, we know that you started out with Bridge. Everybody's kind of waiting. You guys have a history of kind of building these great platforms, and integrating things in. So tell me.
Break that news here.
Oh, break it.
So one, we listen to our clients. So who are our clients? They're all of us, our families, and their self-insured employers. And what they worry about, we worry about. So they're saying musculoskeletal. They're saying cancer is a big issue. They're saying behavioral health is a big issue, particularly behavioral health for teens. And now with the pandemic, that has just exploded.
Yeah.
So you should expect to hear from us in all those areas of expanding our offering in those areas. And the other thing is just something that's very we would think is routine, and that's the availability to hear a human voice on the other end that actually cares. And that's missing from healthcare today. So, when I usually give my example of saying, who out there has received a bill that says this is not a bill, right? And everybody says, and who has had to hang up while they're on hold with a payer? Gosh. And everybody says yes to that. Well, that is all gone from our experience. And there's others who are working on that. Oscar, a great organization. They're doing some great stuff. And they are reinventing the experience just like we are. So it's popping up more and more. And some of the payers around the country, some of the more innovative ones, are also really working on reinventing the experience. But it's still an uphill battle. And we're just we're at the first incline. We've got some work to do.
So are you still shopping around for some of these things, or have you already picked and you're going to make announcements soon?
Well, I think
I have to ask for our health tech friends out there.
We're always looking for build, buy, or partner.
Okay.
And I would add a fourth one, and that is invest, because we have some relationships where we invest in them, they stay independent, we join their board, and we want to make sure the experience that they're providing to our members is unique. And the good news for them is we're not skimming off the top. We're not somebody who says, we can redistribute your product or resell your product. We just want a little piece. We don't want anything. We just want the best pricing for our members. And that's so generally we're great to partner with from that perspective, because, everybody else wants a piece of it. And that's the story of healthcare.
Well, yeah. And that's how you got put into this in the first place, right? When you were with Livongo.
Exactly. I mean, because we looked at a situation where, why should it be that, let's take a different example, where somebody is redistributing the med, they don't even touch it, and they're making thousands of dollars on a medication. That shouldn't happen. And in today's world, it doesn't have to. And the beauty is, we've seen PBMs, they're starting to get remade by Roe and by GoodRx and by Capsule and by all of the different players out there who are basically saying, we found a better way to do this. And they've gotten to scale incredibly quickly.
Yeah.
They're all worth billions of dollars today. And unlike some of the other inflation we see, these are real companies that are really doing it. And if that can be remade that quickly, how quickly can we remake the payers? And that's what we're focused on.
I love it. I love when I get you fired up about the payers. Awesome. All right, Glenn, we've got our eye on you. We've got our eye on Transcarent. Thank you again for stopping by. For those of you who want to check out the other interview where I talked to Glenn extensively about the Walmart deal, check that out. It's up on my YouTube channel along with thousands of other interviews with the who's who of health tech. That's over at youtube.com/WTF Health. We'll talk to you guys soon. Glenn, thank you. It's always a pleasure.
Thank you. Great.
All right, good to see you in
with
person.
Yeah. Bye-bye.
Bye.